And it ain't pretty.
In the recently reopened states, the steady rise continues. Case numbers remain high in Victoria and really high in New South Wales, hospitalisations doubling in the space of a week. Among the state's 3 deaths, all of whom were double vaxxed, a man in his 80s.
This is the first known death in New South Wales linked to the Omicron variant of concern.
While the vast majority of severe cases are unvaccinated, with the Delta strain believed responsible for most ICU cases, Omicron is still wreaking havoc of its own. Among several key industries, the healthcare system is spread thin, not by admissions, but by self-isolation requirements for workers.
We have about 2,000 staff that are furloughed at the moment. That's putting enormous pressure on other staff in our hospitals.
That pressure could be alleviated by loosening the definition of a close contact.
They'll only be considered a close contact if it is their household-like contact who they've spent a considerable amount of time, say more than 4 hours with, on a daily basis.
Another option, shortening the mandatory self-isolation period.
Well, this is aimed at bringing people back to work quicker.
I'm certainly in deep conversation over the last probably week about whether or not it's viable.
Omicron is much more infectious, but people tend to get infected very quickly. It's so efficient in causing infections. We may not need to ask people to quarantine for as long.
It's not without precedent. Britain requires just 7 days isolation for positive cases who return 2 negative rapid antigen tests, while South Africa's scrapping isolation and testing requirements for anyone not displaying symptoms. So, with thousands of Aussies from all walks of life sure to get that dreaded notification in days to come, do we need an ISO overhaul?
You have to get it right so that you balance the disruption and the imposition with the public health gains in terms of slowing the virus down.
I got a test 2 days before Christmas and there were really long lines. It was like 2.5 hours I had to wait. And there was a guy in front of me who was getting really angry about how long it was taking. He started teeing off on the frontline workers. And I was torn because part of me, I'm like, you shouldn't be mean, particularly now, to frontline workers, but also I'm like, this is a great way to pass the time. I loved it. You got taken off to a little room for rude people, I think, and then I never saw him again.
Extra sort of stabbing motion with the...
You got a particularly painful test.
I don't think they were very nice to him.